In 2020, the Ministry of Health and Wellness deployed multiple strategies to keep the country safe during a global pandemic, all while improving access to quality care in the public health sector.
It's about how we position ourselves to give the best possible service to Jamaicans who use our public health system.
The Ministry of Health and Wellness confirmed Jamaica's first case of COVID-19 on March 10, weeks after other countries were already seeing massive outbreaks.
As early as January 2020, the public health team began to develop protocols that would help to delay the entry of the virus into the country, contain its spread, and slow the transmission among the population.
The ministry spent $6 billion in its fight against this new virus. $775 million in financial support was given to health authorities to help their response efforts. There were infrastructural upgrades to the tune of more than $89 million. This included equipping hospitals with an additional 63 intensive care and high dependency units. One of 4 field hospitals was completed during the year to provide additional beds for COVID-19 patients. The National Health Fund financed more than $500 million worth of prescription drugs and introduced its home delivery service for clients 60 years and older. More than $1.7 billion was spent sourcing medical equipment, including ventilators for patients and personal protective equipment (PPEs. There was an increase in the deployment of health personnel. A 3-year technical cooperation agreement was also signed with the Cuban government, which saw a cadre of healthcare specialists from that island coming to help the COVID fight. Another critical component of the response was testing, and 2 locations were set up for conducting the gold standard PCR test, while antigen testing was introduced as a pilot in 9 public health facilities as a faster and less costly method.
This is a very good and meaningful development for testing in the country.
Government also worked with local labs to begin administering both the PCR and antigen tests later in the year. Early in the outbreak, travel restrictions were imposed to limit imported cases, and when the ports were eventually reopened, it came with strict regulations, including pre-testing and a mandatory 14-day quarantine for visitors. The country was also praised by the international health agencies for its critical use of contact tracing and active field surveillance to quickly identify and suppress new cases, including community clusters. As the situation evolved, the ministry developed and guided the execution of over 50 COVID-19 safety protocols under the Disaster Risk Management Act. And with an eye to the future, a COVID-19 recovery plan was developed, as well as an implementation plan for the rollout of any vaccine approved for use in Jamaica. The Ministry of Health and Wellness also targeted resources to the management of other viral public health threats in 2020. Approximately 3,000 doses of the flu vaccine were sourced for high-risk groups free of cost. To get dengue fever numbers under control, early in the year, 36 communities were selected for intervention under a national dengue cleanup exercise. 60 new vector control vehicles, foggers, and other equipment costing approximately $400 million were bought to support the interventions.
Today represents another tangible manifestation of the renewal of public health in Jamaica.
In January, the ministry accelerated a program to upgrade the infrastructure of 13 health facilities as part of the IDB-funded $50 million health system strengthening program. The European Union also committed €10 million towards its implementation.
Tackling not only the badly needed physical upgrade of 3 hospitals and 10 health centers, but also the purchase of new equipment to support the delivery of care and the design and implementation of information systems.
Meanwhile, ground was broken for the construction of the Buff Bay Health Center in Portland, and a new health center was opened at Browns Hall in St. Catherine, costing $24 million. Under the Program for the Reduction of Maternal and Child Mortality (PROMAC), 4 maternal and neonatal high dependency units were constructed.
It is giving mother and child care in our country a significant boost.
Also, a contract was signed for the procurement and installation of a neurosurgical microscope, specially adapted for surgeries involving the brain and spinal cord at the Kingston Public Hospital. A $262 million grant agreement was signed between the governments of Jamaica and Japan to purchase a range of medical equipment and supplies, and bandwidth was increased for the Kingston Public and Victoria Jubilee hospitals, ensuring high-speed transfer of scanned images and lab tests. Government's efforts to upgrade public health infrastructure was also supported by the Adopt a Clinic initiative in 2020.
The adoption is a way to engage the community in being a part of the delivery of public health to that very community.
To protect its investments in public health and the persons who use the spaces, the ministry signed contracts with 5 companies to upgrade security protocols at facilities managed by the Southeast Regional Health Authority. When re-elected Prime Minister, Andrew Holness named a new cabinet. Minister Tufton retained his portfolio responsibility, while Juliet Cuthbert Flynn was appointed Minister of State. She was assigned several areas of responsibility, including maternal health, HIV prevention, and the wellness agenda. In October, the new state minister signed a $3.6 million cooperation agreement with the United States Centers for Disease Control and Prevention. It was to support the national HIV response strategies and refocus and reprioritize key actions towards meeting the UNAIDS 1990 targets.
For the first year of the agreement, some of these priority actions will include development of the digital HIV/AIDS confidential reporting form and validation of the data, which indicates that 90% of all people living with HIV know their HIV status.
Efforts to have more persons tested for HIV/AIDS was boosted with the addition of a mobile testing unit. As part of the wellness agenda, the Tobacco Control Bill was tabled in Parliament to help address the epidemic of non-communicable diseases, NCDs. The ministry also launched a $100 million public-private partnership program, offering free access to care and testing at private physicians for 5,000 patients having ailments such as diabetes and hypertension. A $1.1 billion contract was signed to meet the dietary needs of patients and health staff at the Kingston Public and Victoria Jubilee hospitals, and a $74 million staff welfare program was launched.
The objectives are to increase staff morale, reduce the effects of burnout, build staff capacity within facilities, and boost the overall effectiveness and efficiency of service delivery.
The Ministry of Health and Wellness, keeping Jamaica on a healthy path in 2020, while laying the foundation for the country to build back stronger from the COVID-19 pandemic.